Hello everyone, I'm Dr. Ansu and Matthew and I'm a registered pharmacist. Today I thought of sharing some information regarding osteoporosis. So let us have a brief discussion on osteoporosis. So what is osteoporosis? Osteoporosis causes the bones to become weak and brittle. So brittle that a fall or even mild stress like bending over can cause a fracture. Bone is a living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. Osteoporosis affects men and women of all races. It mainly affects women who are past menopause, like after the menstruation has ceased. They are the highest risk of developing osteoporosis. So, what are the symptoms of osteoporosis? There are typically no symptoms in the early stages of bone loss, but once the bones have been weakened by osteoporosis, you might get the signs and symptoms. And the signs and symptoms include back pain, which is caused by a fractured or collapsed vertebra, a loss of height over time, a stooped posture, a bone that breaks much more easily than expected. Osteoporosis can be present without any symptoms for decades because osteoporosis doesn't cause symptoms until bone breaks. Therefore, patients may not be aware of their osteoporosis until they suffer a painful fracture. The symptom associated with osteoporotic fracture usually is the pain, and the location of the pain depends on the location of the fracture. So, what are the complications of osteoporosis? Bone fractures, particularly in the spine or hip, are the most serious complications of osteoporosis. In some cases, spinal fractures can occur even if you haven't fallen. The bones that make up your spine can weaken to the point of crumbling, which can result in back pain, lost height, and a hunched forward posture. What are the risk factors for osteoporosis? So, the risk factors include your gender. Women are more likely to develop osteoporosis when compared to men. Age. The older you get, the greater your risk of osteoporosis. Family history. Having a parent or sibling with osteoporosis puts you at greater risk, especially if your mother or father fractured a hip. Body frame size, like men and women who have small body frames tend to have a high risk because they might have less bone mass. Next factor is hormone levels. Osteoporosis is more common in people who have too much or too little of certain hormones in their bodies. Examples include sex hormones. Lowered sex hormone levels tend to weaken bone. Like the reduction of estrogen levels in women at menopause is one of the strongest risk factors for developing osteoporosis. Men also have a gradual reduction in testosterone levels as they age. Osteoporosis is also associated with overactive thyroid, parathyroid, and adrenal glands. Osteoporosis is more likely to occur in people who have low calcium intake. Like, as we all know that calcium plays a major role in the development of our bones and all. So low calcium intake can contribute to decreased bone density, early bone loss, and increased risk of fractures. Also, restricting food intake and being underweight weakens bone in both men and women. And surgery to reduce the size of our stomach or to remove the part of the intestine limits the amount of surface area available to absorb nutrients, including calcium. So these surgeries include those to help you lose weight, and for other gastrointestinal disorders can increase the risk factor for osteoporosis. Long-term use of certain medications also interferes with the bone rebuilding processes. So, long-term use of oral or injected corticosteroid medications such as prednisolone and cortisone are associated with increased risk for osteoporosis. Osteoporosis is also associated with other medications used to treat seizures, gastric reflux, and cancer. Certain lifestyle habits can also increase your risk for osteoporosis, like sedentary lifestyle, like people who spend a lot of time sitting have a high risk of osteoporosis. Then, excessive alcohol consumption, tobacco use are the other lifestyle habits which can increase the risk for osteoporosis. So, good nutrition and regular exercise are essential for keeping our bones healthy throughout our life. As we all know, protein is considered as the building block of our body. So try incorporating more amount of proteins in a diet. Good sources of protein include soy, nuts, legumes, dairy products, and eggs. And also, we know that calcium and vitamin D is very much important for our bone health. So maintain normal levels of calcium and vitamin D levels in the body. The good sources of calcium include low-fat dairy products, dark green leafy vegetables, soy products, and also salmon, sardines. These are the good sources of calcium and all. Or if you find it difficult to get enough calcium from your diet, consider taking calcium supplements also. Vitamin D also improve your body's ability to absorb calcium and improves bone health. Exercise can also help you to build strong bones and slow bone loss. So these are the few measures that can be taken from our side so as to reduce the risk for osteoporosis. So this month, that is May month, is considered as the National Osteoporosis Awareness Month. So I just wanted to make you all aware regarding osteoporosis. I hope this information was useful to everyone. So thank you for listening. Stay safe and stay healthy, everyone.